much focus in digital, and in particular in the healthcare side. Around the world, we have over 4,500 professionals that focus purely on healthcare, and we operate in over 46 countries. Um, we do a few things. One area that I mentioned, we range it from doing the strategy, go to business process alignment, into technology evaluation, into community health assessment, analytics, so on and so forth. So pretty much end to end in the healthcare side. But today, perhaps what I'll do is that I'll spend a little bit more time talking more from the perspective of a hospital, and also from how hospital using digital technology, and what are some of the areas that perhaps some of the audience here can take away to improve. Next slide. I'll starting off with a quote from the CEO of Kaiser Permanente, Robert Hill. And what he's saying is that now we are entering into a new era, and roughly about more than 30% of the work that we are doing is going to change. You know, either you are a healthcare provider, you are a device manufacturing, or and the way that we treat the patients also have to be different. Now, why is that happening? Well, first of all, it's because of digital technology is coming in. Now, can I do a quick poll? How many people are actually having one of this device, smartwatch, or who's actually using, Apple Watch? Okay, well, we have quite a few people here. I guess that's one of the trends, because basically we are now getting into the point where devices can also help improve our wellness. Now, I use one of these Garmin watch, and the information that's collected, number of steps, how well I sleep, and the exercise I do is actually not only kept on the mobile, but also move up to the cloud. So, one of the trends that we actually are seeing is our 5 trends. One is healthcare on demand. Now, what healthcare on demand means is exactly what I mentioned, which is that a lot of the information, a lot of data are now being put up on the cloud. And so, for example, coming back to the example of the handheld devices like this, I can actually compare, let's say I'm going to run a marathon, and I do have a friend who keep on bugging me about running marathon, and he's a very good avid runner. So with a device like this and with a cloud, it can actually give you a recommendation, how you should actually improve your nutrients, what kind of food you should eat, how well you should sleep, what kind of muscles you have to build, right? So these are now becoming a new trend in offering healthcare. In Singapore, for example, Health Hub, which is Singapore government pretty much like a proactive electronic health, allowing all of the citizens in there that actually have a device like this to come up with a healthcare program for themselves. So if they want to improve reducing weight, for example, they can go into Health Hub and actually look at some of the programs that they do, and then through the devices they can actually measure and improve, as they go. So it is not only now at the personal level, it now actually becoming very pervasive at the national level. The second one is on personalized and connected health. Oh, by the way, the way that we spotting the trends here and the predictions here, we're looking at it from the short, medium, and long term. So short is between now and 3 years, medium is between 3 and 5, and the long term is between 5 to 10. On the personalized and connected health, now IoT, Internet of Things, is becoming such a prevalent now today. And in particular, it is now being implemented for an elderly. In Singapore, for example, again, we have a community, in fact, one area that basically the elderly live on their own. And in the housing complex actually has a number of sensors, and the elderly actually wear one of these wearables. So in case they fall, in case, and also some of the devices is being kept on underneath the mattress. So how well sleep, whether the way that they toss and turn, is becoming very peculiar. Then it can send a signal directly to the healthcare provider, and then send out the emergency services to come in and support and help them. So a lot of those the new digital technologies now is becoming very connected and variable. And I think I also saw some of the medical device here, where you can actually digest one of these small pills that take photos of your internal organs. So instead of you having an invasive testing, you can swallow one of these tiny pills that basically keep track and then providing a lot of the data on your vital organ. Implantable. Also, that's the other part. And they're talking about, and you're going to see the next trend, which is more towards closer and closer to a cyborg. But that's a little bit far-fetched, but we're getting there. Next slide. The other part is on the treatment innovation. We have, and I will talk a little bit more about practice-based evidence, because this is an area where it is most crucial nowadays, and medical practitioners, the doctors now, is moving and enforcing the practice-based evidence approach to ensure that the intervention and a lot of the diagnosis and prescription are aligned with the research and the evidence that comes out. Okay, so I'll talk a little bit more about that later on. The other part, the other technologies is AR, VR. They call it extended reality now. Mostly used for education, treatment, especially for medical students to understand the different vital organ and to be able to do a simulation. 3D printed cast, and areas like robotics surgery. Robotic surgery now coming around. So in the area of prostate, for example, prostate surgery now, actually use robotic to do that kind of surgery with a real precision. A quick poll again, anyone here actually have LASIK? Done with LASIK? Have LASIK? Okay, yeah, perfect. Because LASIK is also the new generation of LASIK. You hardly actually have the doctors, touch you. Basically now it's all programmable and using the equipment, robotics to basically do the surgery. Next. Last but not least are two areas. One is hybrid workforce. This is the areas where human and AI is coming in. And we are now seeing this with Watson, for example, IBM Watson. You actually have a huge database and also a machine learning AI capability for oncology. So cancer treatment, cancer care, for example, they can provide a secondary opinion to doctors to ensure that their diagnosis is aligned with evidence-based, right? And the good recommendation that comes out from those areas. And I mentioned slightly about the rise of robot. Medical drones, it would be interesting because I think that's not too far away. But especially it's going to be for rural, when you need to actually get medications across to the people at the rural area. That would be a wonderful way to deliver the right medication. And obviously the physical environment in the hospital also going through a lot of those changes as well. Next. I'll show you, since we are at the medical conference here, a medical devices conference, so I'll show you the trend that KPMG is looking at medical devices by the year 2030.
The surface, prospects for the medical device industry appear bright. By 2030, the global market is set to more than double and reach $800 billion, powered by a host of exciting innovations. But unsustainable healthcare costs and new technology-enabled competitors threaten to turn medical devices into mere commodities. If they don't act now, device manufacturers risk getting caught between suppliers on one side and distributors and providers on the other. And new entrants will harness data to cut off access to patients and consumers. In order to stay ahead, today's companies need to turn their products into smart devices and integrate customized services and intelligence into their offering. More players will take on broader roles in a bid to get closer to the customer and create real value. The industry's value chain will rapidly evolve. In 2030, we believe multiple value chain configurations will exist, driven by new business models, technologies, and competitors. The key to future success lies in selecting the right configuration for your company. One option is to bypass the chain and connect directly with patients and consumers through intelligence that promotes self-diagnosis and preventative care. This shift to the consumer will be enabled by a host of digital health solutions including wearables, mobile applications, and remote monitoring. Another option is integrating along the value chain through strategic alliances with or acquisitions of providers, distributors, and even payers. These partnerships will be enhanced by offerings such as value-based pricing that increase the return on healthcare spend. Some companies will further extend into building trusted healthcare brands that span the value chain, creating a one-stop shop for care. This option will provide customized care solutions with products, services, and intelligence fueled by the latest advances in 3D printing, blockchain, robotics, and many other technologies. To meet the rising pressure to provide greater value at lower costs and not get caught in the middle, medical device companies must quickly identify and capture their place in the new value chain. Those who do so will shift from being part of the problem to being part of the solution for healthcare. Contact KPMG strategy professionals to help your organization avoid a future of commoditization.
Yeah, we work with a lot of medical devices companies in looking at how they should position themselves in the future as well. But today I'll talk a little bit more on the healthcare side. I just wanted to starting off with just saying that a lot of technologies that's being implemented in the hospital are not very successful. This is a good quote from Robert Bochner and from UCSF School of Medicine that says that the technologies that's being implemented are quite, when they started off, they are very gung-ho, very excited, and believe that the technology that comes in would really make a difference. But once it's being implemented, things change. And by the time that you actually started to get any kind of benefit out of that, it takes a long time. And why? The question is why does it like that? So we've done a couple of studies, a few studies. The first study is on the left-hand side, and in fact, these two publications, you can download it from cambridgeit.com. The first one is called Accelerating Innovation and the Power of the Crowd. And the crowd here talks about all the different stakeholders. So in this study, we basically surveyed and talked to the healthcare leaders in over 39 leaders across the globe. We talked to doctors, medical and providers in the US, in Europe, and in Asia, and also in Africa. And we collected a lot of sampling data, trying to understand why a lot of the e-health projects fail. And then we take that learning and then we go into a little bit more focus and then into a study in the different areas in the digital health, and came up with a second study which is called Digital Health, Heaven of Health, which is some of the recommendations and the points that I'll be speaking today. But what we found is, number one, there's a lot of push on technologies, which means that a lot of the companies, a lot of the hospitals, basically take technology and slap it on, and forcing the healthcare providers to basically use them without having to go through a whole business process alignment and changing the mindset, or even looking at the pathway of treatment. Okay, so that's one of the very clear indications from all of the failure that we found. So based on that, we actually have a number of points that we just said, we stated up there, things like the strategy pathway, clinical pathway, and then basically developing workflow to align with that. The second is the power of the crowd, which means that the crowd here is all the stakeholders. It's not only the hospital, it's not only the practitioner, but also people like medical devices manufacturing, insurance, for example, and all of those people in the value chain, and have to get them involved. Importantly, is the data, because now even more important, because a lot of the devices now produce and generate a lot of data, and those data should be turned into information. And a lot of data being neglected, but those data and the information, you can use that to create a proactive care for the patient. Fourth is obviously, it's quite obvious, collaborative. But here, all of in the medical community are talking about connected health, and everybody talking about collaborative, but there's no clear alignment and an approach to basically align and ensuring that there's a strong collaboration between all of the stakeholders. And then looking at technology as a disruptor as well. An example would be, doctors hate to type. We all know that. And now a lot of the health information systems, right? When the doctor goes in and then you have a patient sitting across from you, doctors have started to talk to the patient, and then the patient's telling you what happened, their sickness. And the doctor has to start to do a lot of typing. Now this is really go against the way things should be done, because the doctor should be spending more time talking and understanding the patient. So there's a lot of new technologies now, using natural language, speech recognition, for example, allowing the doctor to basically dictate and then talking to the patient, spend more time, and transcribe that directly through those kind of devices into the system. So these are some of the examples of that. Next slide. I'll show you a little bit of a good case study at Johns Hopkins, because this is a good video that shows about how technology align quite well and how to use, and this is quite a simple technology, by the way. Okay.
I'm Rick Bennett, President of Johns Hopkins Medical Campus. I'm excited to share this update on how new investments in using technology will not only help us take better care of patients, but will also make our daily work easier. We are describing these new initiatives as the next generation of healthcare. I hope you enjoy learning about how we are now expanding the use of smartphones and tablets to make patient care safer and easier.
Our upcoming mobile technology projects include tablets for patients and also expanding features of the new smartphones that we recently implemented across the hospital. And most everyone already has one of these powerful tools, pretty easily accessible. So leveraging smartphone technology to do more for our patients, our families, our staff and providers, it just really makes sense. It's also important to explain to patients how the smartphones play a role in patient care. And when patients understand that care team members are using these phones to help them, and they pretty quickly realize that this is really about providing the best and safest care for patients and families.
In November, Johns Hopkins Baby rolled out a new mobile clinical communications platform. We replaced the phones that our nurses and other clinicians were using with new smartphones that allow secure, HIPAA-compliant text messaging and phone calls. The system has helped streamline clinical workflow, reduce patient discharge times, and reduce alarm fatigue for nurses. It's easy to use, and feedback from staff has been overwhelmingly positive. Many units are reporting the option to send a text message instead of making a phone call has made communication quieter, something I'm sure our patients appreciate.
Our physicians have been thrilled with the new voice recognition system. It frees up time for them to do what they really love doing, interacting with patients. Using a microphone at a computer or on their smartphone Physicians can dictate their patient notes, then see them immediately and accurately transcribed from our electronic medical record. Physicians who used to say the electronic medical record was tedious to use have been transformed into some of its biggest fans.
With the upgrade of our electronic medical record system in February comes another way for nurses to use their smartphones for faster and safer patient care. With this new technology, nurses can use their smartphones to scan patients' barcodes for medicine administration. Nurses and techs can document vital signs and intake and output quickly right at the patient's bedside. It's exciting to see how developments like this can simplify life for our nurses and help eliminate the potential for errors for our patients.
SIGSERT is really excited to be one of the 2 early adopter units from MyChart Bedside, which will be introduced to all of the inpatient units at Johns Hopkins Baby in 2019. Patients spend a lot of time waiting and worrying while they're in the hospital, so with MyChart Bedside, patients can use a hospital-issued tablet, and a free application to be more informed and involved in their care plan, as well as see test results and learn more about their diagnoses, their treatments, and their medications.
While nothing will ever replace the importance of face-to-face interaction in healing and healthcare, we know that technology can be a powerful tool that connects us with patients in new ways. Thank you for being a part of this journey.
I know that that's a little bit of a bit long on the videos, but the point that I wanted to make in there is that there's an alignment, there's a collaborative. In using the technologies in there, you're basically creating the workflow that is patient-centric, all the way from the nurse, the doctor, and all the different practitioners in there. Collaborative, and also making sure that the communications cut across and very quickly to respond to the patient's requirement. Okay, so here I know that a lot of the hospital and also a lot of the healthcare providers is already implementing some sort of digital technologies. So here are some of the examples and some of the opportunities that we are seeing as an areas for hospitals to basically improve and maximize the benefit of using digital technologies. So I'll go to the first one. Next slide. So the first one is basically with the trends and the move towards evidence-based practice. Now, what evidence-based practice is the way that the doctors are caring for the individuals, for the patients, diagnose and also come up with prognosis based upon research evidence. Okay, traditionally, a lot of, in my parents' time, even in my early years, when I go see a doctors would basically prescribe and come up with prognosis based upon their experience, based upon what they learned in a book, when they were younger. But nowadays, with the research, clinical trial, clinical care available out there, there's a lot of there's a trend right now that are pushing towards what they call an evidence-based practice. Now, with evidence-based practice, it means what? It means a lot of information. It means that you're required to actually be up to date on the research information about your medications and about allergies, for example, when you prescribe, and also based upon clinical and also the lab report that came out based on those samples. So there are a number of good solutions, digital solutions out there that are now being implemented across to ensure that there's a good practice for evidence-based practice. So these are examples would be the Clinical Decision Smart Support Systems, CDSS, that's now is coming online, and for a number of hospitals that may not want to implement it, there would be a simple, it can go all the way from a simple hyperlink to those guidelines, and also to be a little bit more sophisticated, can be connected and creating a workflow as a one-click flow directly into computerized physician order entry system. So in doing this, right, from prognosis all the way to medication issuing, you can reduce the number of medication error by up to 48%. And this is now becoming the new way of doing prognosis and also caring for patients. But not only that, but it is required that we look at the whole workflow, taking a clinical pathway, taking a particular disease and cure, and then go through the whole thing to create the standardized workflow based upon all of this. Next. The second area is that there's a growing trend now for patient engagement and self-management. There are patient portals that are now readily available, and making sure that the patients now care for themselves as well. So not only just coming to a hospital, but once they are being discharged, a lot of those information are being placed into the patient's portal, so that they can basically start to look after themselves as well. And also things like the Patient's Health Network. An example would be Patients Like Me. This is an insight and experience of similar people that actually gone through the kind of similar sickness, that they can actually have a peer discussion, go into a little bit more detail, and things like that. So these are some of the self-service that we actually do recommend that hospital and also providers started to look technologies. Next. Next one would be more of analytical, or to do a predictive analytics. As I mentioned, there's a lot of devices, wearable, that now is coming into play, and collecting those kind of data together with an upcoming more and more genomics information, you can use that and then put it into big data for predictive analytics. And with this, it basically is going to help reducing the cost and allow the provider to intervene earlier to ensure that the patient are well cared. Okay. Next. I mentioned about better coordinated care. This is an area that I know that a lot of hospitals are going through a lot of pain in implementing it, especially electronic health record. And because of the privacy issue as well, and because of connectivity issues, it is not as simple. But electronic health record is being implemented worldwide now in a major hospital. And basically it allows the record to be shared across different healthcare providers as well. And as a patient, let's say for example, I live in Bangkok, I go up to Chiang Mai, I'm not well there. And for some reason, I'm unconscious. If I have electronic health record like that, the doctors over there will be able to pull up my medical records and know that I'm alive. So when they treat me, then they know exactly that they shouldn't give me any kind of medications that's related to penicillin, right? So electronic health record, it actually has a lot of benefits in doing this. Next. This is the other areas that we are looking at, that we're making suggestions, because there are now a lot of telemedicine services, okay, that's coming in. And with this, it basically allows the rural to have a to the specialist care. This is an example of a company called Halo Health. Halo Health is actually in Indonesia, and basically this is a story of this journalist who basically have problems with his eye because he spent a lot of time in front of and he's also have diabetes, so he got some problems, and now he's able to, through Halo, talk to a health specialist and also get prescription online delivered to his home. And for some of you that actually been to Jakarta, you probably know that the traffic there is terrible. So this can actually help save quite a bit of time. Next. These are the other areas that we are looking at, how digital health can actually help, would be technology to help plan the staff roster better, and also ability to manage the patient flow and match the capacity to the demand. These are quite simple. Forward. Next. And with digital technologies now and the requirement of changes going on in the healthcare, it is important for the healthcare to continue learning, and online learning, digital learning, all of this is really available to ensure that the staff continue to learn. Next. So I guess I'm coming to the very end of my talk, and basically there are 7 lessons that I like to suggest. Okay, a lot of the digital transformation, a lot of the projects fail, mainly because they actually are not looking at the process, changing mindset, understanding the transformation that's going through. So the recommendation that we have is, the first one is there has to be a transformation program, looking at the whole change process within the hospital, and also looking at how the technology that comes in would basically align to that. The second issue, the second recommendation is that it is a people problem and it's not a technology problem. Technologies always works the way it's supposed to, but basically it is how it is being collaborative, how it is being aligned, how the data is being input in there that basically makes it not working. So the alignment there would require a good leadership to basically pushing it down, ensuring that there would be an alignment. And looking at the system design to be a key component of it, focus in analytics, because as becoming more and more, it is more important that investing in analytics and how you can use those big data to drive the care will be quite important. So the care here, you're talking about both proactive and also preventive. So for patients that are being discharged, a lot of the analytics, discharge record would actually include some of the medications that they have to take, and some of the behavior and the habits that they have to change as well. So with analytics and the sensors would actually allow them to have a better lifestyle in managing all of that. Multiple iteration and learning, and for some of the medical practitioners, it is also a requirement to learn, unlearn, and relearn as well. And support interoperability. This is something that more towards the people who's focused in the technology side, like the CIO, for example, the interoperability of all the different systems. The different systems to have a different standard, and basically aligning to an open standard, allowing all the data to interconnect would be very important. So in designing a system, it is important to focus on ensuring the data can be shared across. Last but not least, sound information governance and data security procedures. I remember watching a movie recently, a show called Blacklist, and in this episode, there's this huge billionaire who make a lot of money from a pacemaker, and apparently this pacemaker is connected onto the cloud, and this villain basically have this capability to hack the system and ransom the billionaire, and say that if you don't pay me $40 million, for example, I will basically turn off all of those connectivities. Therefore, all of the patients will probably have a heart attack and die. So security is very, very important, especially now we are moving towards a wearable, moving towards more of Internet of Things technology. So cyber and cyber attack are real. A matter of preventing it, but it is a matter of when it's going to attack you. You know, so cyber security, the right data governance, the right governance across the whole process would be quite important. Okay, so that's can I have the last slide? Next one. So these are some of the publications that we have, and you know, for anyone who's interested in getting a lot of those insights, you can go into kpmg.com and you can download it. There's no charge. These are some of the learning, some of the surveys, some of the research we've gone through. So thank you very much for your time. Thank you for your attention.
Thank you very much, Khun Nathasap Rotanapichen, Senior Advisor, KPMG Business Advisory Services. And thank you everyone for your attention. On behalf of Impact and Medical Devices ASEAN 2019, we would like to give thanks and appreciate for your kind support and hope to see you again in 2020. Thank you very much.